Hi, I'm Ben Massenberg, one of the chief residents here at the University of Washington, and I'm here with Dr. Richard Hopper, the Marles Larson Endowed Chair of Craniofacial and Plastic Surgery and the current president of the International Society for Craniofacial Surgery. How are you doing today, Dr. Hopper?
Hi, Ben. I'm doing great.
So, we're going to briefly chat about distraction osteogenesis, and you've been very influential in that field. So, do you mind giving us a brief story of kind of your introduction to the techniques of distraction osteogenesis and how you became so passionate about it?
Yeah, it's kind of hard to think back that far, but I do remember 21 years ago graduating from the University of Toronto and knowing I was wanting to go into craniofacial surgery. At the time, distraction osteogenesis was being done, but only in certain places, and there was only one person who I knew that was doing it at the level and the volume that I wanted to spend a year to learn from, and that was Dr. Joseph McCarthy at NYU Medical Center. So I was fortunate enough to be able to go and join Dr. McCarthy in his fellowship in New York. It was just before 9/11. It was in 2000, and I spent a year just learning from the genius. He took the time to talk about the intricacies of distraction, his thoughts on vector, his thoughts on device, his thoughts on indication. It was an amazing experience.
Cool. And so, as we've seen distraction change a lot over the past kind of 30 years with new applications like counterclockwise craniofacial distraction osteogenesis, where do you see it going next?
Well, that's those are two good questions actually. One is like what's happened over the past 30 years, and then the next thing is where is it going next? And I don't have the only answer for both of those, but I my perception of what's happened over the past 30 years is there has been a bit of a pendulum swing. So when I went to New York, mandible distraction by and far was the vast majority of all distraction cases. Almost all of them were mandible. The pendulum swung now where things like mid-face surgery, Lefort 1, Lefort 3, are more common. I think they've been a little bit more stable in their results and their outcomes, and have really been game changers in the field of distraction osteogenesis. Whereas mandible distraction, which used to be seen as kind of a cure for everything, there was a time when they sort of said, "Is this a farewell to traditional osteotomies, and distraction is replacement BSSO?" I think we know now that it's not replacing bilateral sagittal split osteotomy. It can do some great things to produce bone. It's just not as reliable as BSSO in its placement of the dentate segment. So I would say mandible distractions swung to become less common, with the exception of neonatal distraction, whereas mid-face surgery has become much more common. Where is it all going? I'm excited to see. I do not know. I've explored some ideas where we're combining traditional orthognathic surgery concepts with distraction, such as segmental distraction, especially of the midface, and have been really happy with those results. I've also been exploring things with rotation distraction for airway and complex airway obstruction cases. That's been exciting. But I think really it's your generation that's going to define distraction for the next 30 years, which is going to be what are the devices going to look like? How are they going to apply force? How are they going to fit onto the patient? How are we going to get quicker healing? I think there's some exciting work starting on three-dimensional movements of distraction segments, which again, if once that's achievable with usable devices, that'd be fantastic.
Yeah, great. And you briefly discussed kind of some of the limitations with mandibular distractions. Do you mind going into that a little further about why you think the pendulum kind of swung back?
Yeah, mandible distraction is great, just like any distraction technique of moving a transport segment a large distance, larger than traditional orthognathics can do it. I think that's truly the power of distraction, and that's, as you know, without the use of bone grafts, which is the other benefit. But it's really the positioning in three-dimensional space of that transport segment that can be really challenging in the mandible, given all the muscular forces that are on it, the strap muscles, the muscles of mastication, and they can cause not so much relapse of the mandible segment, but more remodeling of the mandible segment or the distracted mandible. So, some of our research that I started when I was working with Dr. McCarthy and have continued sort of shows that effective mandible length from porion to gonion, this distance right here, is maintained over the years. But if you're looking at the position of chin point, that can drift with time and the strap muscles can pull it backwards. So I think it's more the unique muscular environment of mandible distraction that has kind of created some limitations. I think the final thing, though, is force. When you're putting on for example, an external mid-face distraction device, you're pulling the face forward, so all the face is transmitted through the halo to the cranial pins. With mandible distraction, unless you adjust your technique, you're going to be putting all the force through the condyle to the skull base, and that's been shown to cause condylar changes, condylar resorption, which I found out the hard way doesn't sometimes show up until 10 years later. So it took me a decade to start to see that in my own practice. So now I'm trying a lot more of pull distraction as opposed to push distraction, even in the mandible.
Great. So looking forward to the International Society of Craniofacial Surgery meeting in September. What are you most interested in hearing about and discussing at the meeting?
Yeah, I'm so excited for getting together again with my friends and my colleagues and industry partners. It's going to be a great a gathering. I'd like to see what's happened over the past 4 years. It's been 4 years since we've got together in a real in-person meeting, and I know people have been busy. They've been trying new devices. They've been more critical of their outcomes. They're really starting to try to push the envelope on one aspect, but at the other aspect, they're being very critical and objective and seeing what distraction can do and what it can't do. So I'm really just excited to hear from my friends across the world what they've learned over the past 4 years. I look forward to showing what we've been doing, and just like the theme of the Congress is shooting for the stars. I like to sort of see where are we shooting with distraction osteogenesis for the future to come.
Great. Well, thank you so much for your time, Dr. Hopper. I
No,
appreciate it.
thank you, Ben. It's been a pleasure.
And I'll see you in September in Seattle.
Look forward to it.